Yep.
Good. Okay, so you always want to take your bottle out, okay? Your bottle's going to have this label stuck, or the box will have a label stuck onto it. I just haven't stuck it yet, but what it does is it tells you Xeon, testosterone, inject 0.3 milliliters or 30 milligrams subcutaneously once a week, okay? Some people inject their TIM or into the muscle. It's not necessary, and it actually hurts more. So subcutaneously is just under the skin. So we can do the stomach, we can do the top of the thigh. Some people do it behind the back of their arm, but it's hard. You can't do it yourself. So I usually just encourage people to do the stomach. It's really painless there. First step, take your first alcohol swab and wipe the top off. Just one nice swipe, but make sure you push so that you get the rubber stopper.
Okay.
When alcohol is wet, it does not kill. It kills when it dries. So we have to put that to the side now and let it dry. This swab is now garbage. Okay. Your next step is to open your syringe. So we're going to use a 1 milliliter syringe because it lets you measure specifically for less than a milliliter. If you use a bigger syringe, it's going to be really hard to measure out 0.3 milliliters. So I suggest getting 1 milliliter syringes. So what we do is we open it up, and it's the tip of the syringe that you have to worry about sterility. You can touch all this. This can't touch anything. So what I do is you open it up, and you pull it straight out to the air. This can't touch your hand, this can't touch the table. So what I do is usually get someone with their dominant hand, so I'm right-handed. So I put the syringe in between my thumb and my finger, and I hold it like this, because now I can use my fingers to open the needle. The needle's different. So the needle, the first part that comes out is actually the sterile part, where with the syringe, it was the bottom part. So when you open up, you need to be very careful that when you peel it open, you don't touch that with your fingers. Some people open it and keep their thumb stuck out. Peel it open to the air. You could even use the wrapper to hold on to so you don't mess around so much. They go together and they twist until they get tight. When it's tight, don't overdo it, or you can actually crack the needle base. So just do it till it's firm. So I'll let you feel that. Just grab right here and give it all a twist. Do you feel how firm that is?
Yeah.
That's all you need to do. Don't go more than that, okay? This is now garbage as well. So our next step, we're going to grab our vial again. You're actually going to inject air into the vial because it helps the tea come out. So we're taking out 0.3 milliliters of tea, so we're actually going to add 0.3 milliliters of air. So it's whatever your dose is. So you go to 0.3, so do you see that? The top thin line, that's what you want to use, the top thin line, not the thick black one. So 0.3, you're going to pull the cap straight up. This does not twist off. If you twist it, you'll take the needle off, which is okay. So say you take the needle off by accident, just add it back, okay? So twist till it's firm. But the cap comes straight up and off. You have to pull pretty hard to get it off. You have your 0.3 milliliters of air. You come in at a 45-degree angle and you touch the tip, and then you push and go straight down. That helps prevent you from coring the rubber. If you come straight down with the needle, as you can imagine, it's rare, but you can get a piece of the rubber stopper to go up in the needle, which we don't want. If you come in at a 45-degree angle and touch the tip, it almost like makes a little tear so that when you come straight down, it just slits through instead of coring it. So once it's in, you can inject your air. Then what I usually do is make a peace sign with my dominant hand. You can do whatever you want, but I find this easy. Peace sign with your dominant hand. Put it underneath the rim there of the vial, and then with my other fingers, I kind of hold on to the needle like this, and then you flip it all upside down. When you flip it upside down, nothing is going to spill out, I promise, okay? Some people do this with 2 hands, but the good thing about doing it with 1 hand like this is it feels really stable, and then it lets you pull. So when I say you pull back really far, I mean you pull it back till you're about to 1. And you're going to see the tea slowly come in. You see it kind of jerking down there? If you pull it to your dose, it's not enough of a pressure difference with this size of a needle. It won't fill. So you need to pull it way down and just hold it. And then you estimate. So that's approximately 0.2. This is approximately 0.3 now. So that's your dose. But notice I'm going to keep going. I'm going to let it fill up more because it's easier to push out excess than to have to start all over. So that looks like more than your dose. So I'm going to let go. And I'm going to push that air at the top out. You're going to feel a weird little... I don't know if you heard that. Yeah, you feel it too. So that's normal. And then you're just going to push to your dose. So I'm going to turn it towards me so I can see, and I'm going to push to 0.3. You can see there, it's at 0.3. Okay? And then what you do is you flip the whole thing upside down, you pull it straight out, and needle to the sky, so we don't get any drippage. Now I need to switch this needle with that one. Some people don't do that. If we were really sterile, which we were, you could use this needle to inject. I prefer switching for a few reasons. One, anytime you touch a stopper with a needle, you dull it. Okay, so that's gonna hurt a little bit more. And also, you're gonna put this in your body. So we always wanna make it as safe as possible. These are only a few cents each. I know it's a bit wasteful, but in my opinion, it's worth it. So what you're gonna do now is, imagine if I just unscrewed this. What do you think would happen? Do you see anything in the needle there? It's filled with tea.
Yeah.
Because I pushed it out, remember? So what do I need to do before I switch the needle?
Draw back.
You got it. I'm gonna pull all the tea out of there because that's part of your dose. Okay, also if I didn't do that and I twisted it off, the tea would spill everywhere.
Yeah.
It's happened before, it's not the end of the world. It's such a small part of your dose that I would just encourage you to put the new needle and inject either way, but this is the best way to do it. You can put your cap back on, it clicks when you push, twist counterclockwise, comes right off. This goes in a sharps container. I'll give you a sharps container today.
Okay.
Yours will not be as big as mine, but that's okay. So now remember, this is sterile again because we don't want it to touch anything. Finger and thumb again, hold it. Use your fingers to open it up to the air, keep it nice and sterile. Put it to the top, twist till it's firm, nice and firm. This is garbage. The next step is one more step before we inject. Do you see anything wrong with this?
Pull out all the air.
Yeah, push out all the air.
Yeah.
You got it. So we're gonna push that air out. When your tea gets to the top where the needle is, I want you to slow down.
Okay.
And we want to do a really, really slow push until we see a little ball of tea at the top. See it here in a second. There it is. You see it? So if it drips down, that's totally fine, but now it's ready to go. So now that this cap is on, the needle is in touching the syringe, everything is sterile. So you can now put this down. I cleaned this right before you two came in, so this is a safe space, but for you, I would encourage wiping down the surface before you go. That can stay down there. Now I like to clean up my area so that I don't have anything distracting me during my injection. Okay. Garbage. I'll keep the little information sheet for you. Put this in there. I'm just going to quickly label your box so I don't forget. So it has an expiry of July 22nd. That being said, when you're using an injectable like this, it's really best for you to replace your vial every month. That can be a bit expensive for some people. I usually say it's okay for people to jump up to 3 months if it's a cost issue.
Yeah.
If you have really good coverage that pays for the whole thing, my professional opinion is that you switch it every month. 2 months is okay, but if you're using a vial past 3 months, I really suggest you switching it just because you've poked it almost 12 times at that point, right? So we always want to be a little bit careful. So put your tea away. Always double check your dose. I always double check the patient because I don't want to mix it up. But for you, I don't think there's going to be any other vials around. Sometimes people have different vials though. So make sure it's your vial. Inject 0.3 milliliters once weekly subcutaneously. So this is your vial. So the next step, we just need to take a look at your stomach if that's okay. Yeah. Close the door for some privacy. So I'm just going to need to lift your shirt up, and what we need to do is either tie it in the back. Some people have a binder, tuck it up under. So tuck it up under your binder. So can I touch your body? Yeah. Okay. The rule is 2 to 3 fingers on either side of the belly button. So if I put my fingers there, and there, anywhere that my fingers were covering, we do not inject. Okay, so outside. Outside. I wouldn't go much above that, but you could. Yeah. And you could go below, but not too far. Okay. So we want to, most people inject here and there. So what we want to do is I'm going to give you a pen so you can practice first. And I'm going to grab a pen too. And we're going to hold the pen down low at the base, okay, with your dominant hand. And I want to, this is a term I use for everyone, but I want you to grab a fat pad, okay? So grab a nice chunky fat pad with your non-dominant hand. With your dominant hand, I want you to place your wrist in front of the fat pad. When you're doing your injection, I don't want you to ever move that wrist. That wrist stays planted and firm, okay? The next step is when you're injecting, you're going to inject at a 45-degree angle. So we're not injecting straight down, we're injecting at a 45-degree angle, okay? And you're not injecting with your hand. Some people do this, okay? If you're injecting into a muscle, that's what we do. Subcutaneous, we don't need to do this. In fact, it's not very stable. What we do is just with our fingers, okay? So just practice poking. It's a pen, so it's not going to hurt you, so I want you to actually push into your skin so you get used to that feeling, okay? Because you are going to feel a little bit of resistance. Good job. So nice poke. So let's pretend that we poked and we keep it in there. So poke. So half the needle is in there. Remember, we don't need to do the whole thing. So you poke, you'll feel a little tiny prick, and then when the needle goes in the rest of the way, you won't feel it. So half the needle. At that point, I want you to really slowly let go of the fat pad. And as you let go of the fat pad, you might notice the needle kind of bending upwards. So what, can I touch you again?
Yep.
So what I would do is, as I slowly let go, sometimes you actually need to tilt the needle backwards. Not lift it out, but tilt it. Okay? And you'll see, you'll feel it. If it starts to feel tight as you're letting go of the fat pad, just kind of tilt it back. Does that make sense? It's something you have to experience to understand. If you don't do it, and all you're going to notice is if you don't do it, you'll see almost your skin pulling up here, and it just might feel a little bit tight, but it doesn't hurt. It just feels tension. If you don't like that sensation, tilt the needle back. Okay? So at that point, our wrist is still planted. We've slowly let go. And now what we're going to do is you're going to reach across with that hand that was holding the fat pad. You're going to hold on really tightly to the needle with your fingers, really tight, and keep that wrist planted. Remember, so your wrist is off. So keep your wrist planted. And we're going to reach over and you're going to push the T in. It's going to feel hard. It's going to feel like you have to push pretty hard. But with these needles, it'll be a little easier than if we use the other one. So really steadily, but firmly, push it in. What I don't want to see is when you're pushing it in, I don't want to see you cramming the needle deeper in your skin. That's why you hold on tightly so that no matter how hard you push, the needle isn't moving, but the T is going in. Once you've injected, you'll see here with your fingers, sometimes you have to make room so you can see. You'll get it down to the bottom, and then I want you to move your hand off, exactly, and just wait. Okay? Wait 10 seconds. I may give you a cotton ball to put on top of the needle, but still just keep it in your body. And then when I tell you, or whenever you're comfortable, you can pull the needle straight up. And you're done. Okay? Sounds like a lot of steps, but it's very intuitive, okay? Yeah. So that's fine. So what I'm going to do now is I'm going to swab your body. Actually, you can do it. So grab the alcohol swab, and I want you to do a nice big circle right in this area. It's all one thing. It's okay. Everyone does that. Yep. Do it a little bigger, get all areas, because we often forget where we swab. Perfect. Now you can leave that there. You can put that there, and this will go in the garbage. So long as alcohol's a bit cold, so if you feel, you're not supposed to fan an alcohol, but you feel how it's chilly, if it's like that, it's not dry. It doesn't mean you can't inject, it just means when you inject it may sting a bit. When people talk about the pain from injections, it's often that they didn't let the alcohol dry enough. Okay, so the longer you let it dry, the better. 30 seconds or so should be fine. So what I'll need to do now is just practice holding the needle, okay? So grab it at the base, it has a cap on it, you're not going to do anything wrong. I want you to practice planting your wrist on your body, and I want you to practice grabbing the fat pad. Good. So there's nothing wrong with injecting the area that you were touching the pen on because we alcohol swabbed it, but if you're not comfortable doing that, 'cause some people just don't like the spot, you can inject just below it or just in front of it. It doesn't really matter, okay? But generally speaking, you would just tilt your fingers at an angle so that it goes towards your body. There you go. And you would just push it in. Like I said, some people really stab it in there, which is fine. It's nothing wrong with that. But if you go slow and steady, the thing is to go steady. Some people, when I say you don't need to go fast, they'll do this. Which is like, okay, but it should be more like this. Just nice and you got it. Just nice and fluid. Some people really hesitate with the actual pushing it in. So what I suggest people to do is, if you're getting a bit nervous, I just want you to touch the tip of the needle to your skin, because people think that's going to hurt. You'll realize you won't even feel it. So even if you just touch the needle to the tip and take a few deep breaths, I may say, okay, push, 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 and you'll start pushing and you won't even feel it. Okay? So what I want you to do now is I want you to let go of the fat pad. I want you to take the cap off the needle. So pull straight out hard. Yep. Takes a bit. There you go. Put that cap on the table. I want you to grab your fat pad. Yep. Grab it nice and firm. Put your wrist down and don't move that wrist. Hold on to the needle really tightly with your fingers. I want you to touch the tip to your skin. Okay? You don't have to do anything, just touch the tip. Tilt it down just a tinge. So there we go. Touch the tip to the skin. Yep. Touch your skin, it's okay. And whenever you're ready to start pushing, okay? Because you're pretty much done the worst part. Yep, push. Good job. You're doing awesome. Yep. You got it. You got it. Keep going. Yeah, there we go. So you're in now. Now you can slowly let go of the fat pad. Good job. Tilt your needle down a little bit. Other way, other way, other way. Sorry, back towards there. There we go. You're doing great. Hold on really tightly with your fingers. Reach over and push that in. Are you doing okay? Yeah, you're doing great. So keep going. I know you can't see the plunger, so if you can move your thumb just a little tiny bit, you can see. And when you get right down to the bottom, keep pushing. You're doing awesome. Keep going. Okay, now you can let go of your non-dominant hand, and I want you to just keep it in there. You're done. You did it. I'm just going to give you the cotton ball here now. I want you to put it on top of the needle, and whenever you're ready, you can pull the needle out. So just straight outwards towards the wall here. Good job, you did it. So I want you to put this now in the Sharks container. Don't stick your hand in there, just kind of drop it in. Take some deep breaths. You did it.
Nice.
Congratulations. It's exciting. How do you feel?
Good.
Wasn't too bad, hey?
Yeah.
Yeah, it's a little uncomfortable when you're first doing it, but what you'll learn is it's hard to get used to the pushing in. And sometimes I notice with your skin, and it happens with other people's skin too, sometimes you go to push and you don't feel it go in, so then you kind of get a bit like, what's happening? What am I doing wrong? You're not doing anything wrong. Some people's skin's a little tougher than others, so eventually, I don't know if you saw it, but I saw when it went in.
Yeah.
You might have felt the tiny little prick.
Yeah, I felt it like when it went in.
Yeah, but then once you were pushing it further in, it probably didn't hurt that much, did it? And then when you're injecting, you don't even really feel that, do you? Yeah, so that was it. So I'm fully confident that you can do it on your own. You did a great job. So let's take a look. So little red spot, totally normal. Blood on there, totally normal. Sometimes you will take out that needle and you will see a huge drop of blood come out. You didn't do anything wrong. You didn't puncture your organs. You didn't hit your muscle. You just nicked a little vessel.
Just hit my lungs.
Yeah, you just got your lungs that were so healthy, right? So it happens all the time. Sometimes you won't see blood. Sometimes you'll see clear fluid. Let's see if we can see any tea. No, you did a really good job. Sometimes you'll see clear fluid come out. That's just the tea. It's not losing your dose. It's barely any of your dose.
Okay.
It's normal. So the longer you kind of just keep that cotton ball there, the faster it will clot. Some people like to put a Band-Aid on it. You don't have to, okay? If you feel like you want to, go for it. But for the most part, if I can touch this, if I touch your body again, I'm just going to slowly brush it here just to see if we're going to get any clotting. You're already done. So that's it. Do you want a Band-Aid or anything?
Yes.
Sure.
I like Band-Aids.
Of course. I have a Band-Aid for you. I don't have any fun ones. I used to have Barbie ones that were all dried up so it like cracked her face off and it was so funny. But I only have boring ones now. So either way, you'll get a nice boring one. And I will open it up and let you apply it. There you go. Yeah. Questions?